Checking in about our heart health and learning what's happening at Mercy Health St. Rita's. Joining us today, interventional cardiologist Dr. Sandeep Patel. And thanks for joining us, doctor.
Hi, Holly. Thanks for having me.
All right, so let's talk about the structural heart program and what types of valves and heart diseases that you are working on at St. Rita's to help people.
Sure. Thanks. So we're part of the structural heart team here at St. Rita's, and we basically are working on taking care of patients who have valve disease that can't have surgery. There's really two major valves in the heart that we would deal with on a day-to-day basis. One is called the aortic valve, and one is called the mitral valve. They're both on the left side of the heart. There's 4 valves in the heart, and these 2 are the ones that usually tend to cause problems as we age, just from normal wear and tear. We have sort of worked on developing a team here that's, I would say, perfected the idea of managing these patients surgically and non-surgically. We get together with a whole group of providers, including myself, the surgeons, ICU, their primary team members, et cetera, and we come up with a collective plan to kind of come up to determine what the best strategy is for managing patients. So when we say structural heart, we don't just say it's all about doing it through the groin. We say what's the best option for the patient. And many times it is about doing it through the groin or doing it through catheter-based therapies, so we don't have to cut your chest open. But we really want to highlight the fact that the team comes together to pick the best option that's going to give you the longest and best outcome for what your ailment is.
It sounds like a neat approach, the team approach, because you get different ideas from your fellow doctors, and it comes together.
Right. So there's no patient is textbook. Although there's a textbook written for every single patient, no patient is textbook. And so we have to treat people like they want to be treated, but in the scenario that they're facing. Some patients come to us as outpatient, and have started experiencing symptoms of shortness of breath, chest pain, lightheadedness, dizziness, swelling in their legs. And others come to us extremely sick. They're having heart attacks or strokes, or they're having significant drops in their blood pressure, and they need to have emergent therapies. And there's the whole spectrum in between. And so we can't just say one approach works for every human being. And sometimes we do combined approaches. We're on the cusp of technology here, where we're doing things where patients' hearts aren't beating, and we're able to get their hearts beating and then replace their valves while their hearts aren't beating. Sometimes we're doing combined surgery and interventional approaches so that we can maximize their outcome and minimize their risk. So there's a lot of things that are happening in terms of managing patients where it's just not a one-size-fits-all situation. I think St. Rita's has done an excellent job of recruiting the right doctors to come together to put a team that's really going to give the patients every single option you can pretty much have anywhere else.
Wow, that's neat. I understand that the Watchman procedure, you guys have been using it since 2017, but you're coming up on a milestone for that.
Yeah, I think, the Watchman procedure is an excellent procedure. It was made for patients who have atrial fibrillation and who can't take blood thinners, or who have a reason not to take blood thinners. And there's just a lot of people that, as we age, have a higher risk of bleeding. And as we age, unfortunately, we develop atrial fibrillation. That's the natural history of aging of the heart. And people need blood thinners so they can prevent themselves from having a stroke. In the scenario that what Watchman provides is that it gives you an option to prevent you from having a stroke, but at the same time, you don't have to take blood thinners. And it's a one-time procedure that's about 30 minutes. You can go home the same day. You don't need to have general anesthesia. It's all done through the groin, and we're approaching about 300 Watchmen at St. Rita's now, and that have basically been done accurately without any issues, and we've had 99% success in taking people off blood thinners with no complications and going home the same day. So we're one of the centers in the state and in the country at this point that have been able to do it this way. And to get you home the same day. And we're also going to be a center to teach that to other doctors because people really want to learn how we pioneered this in the community.
It must be neat for you to be able to have, these new things and ways to care for people.
Oh, I love it. I mean, my entire passion has been basically to bring the latest and greatest technology to Lima and the surrounding counties, because I feel like it's not fair that patients have to drive 3-4 hours to do something that we can definitely provide the service here with the outcomes that are equivalent, if not better, than some of the surrounding centers. All of our outcomes are available online. It's just a very streamlined thing. And like you said, we've been doing it since 2017. And now we're about 6 years into this. And it's just a very robust situation for patients to come in, get managed, and get home with the type of care we're giving here.
It is exciting stuff to hear and hear your passion too. So thank you, Dr. Patel, for coming today and joining us.
Thank you, Holly. I appreciate the time.
All right, don't go away. New Edition continues in a moment.